Hey everyone, welcome back to my channel. So the topic of today's video is something that I have been really interested in lately and I have been doing a lot of research on it. In this video, I am going to discuss how your earlobe can indicate the risk of heart attack. Before we get started, I want to remind you to hit that subscribe button and turn on the notification bell so you never miss a video from me. And if you enjoy this video, please give it a thumbs up. Recent research has suggested that the appearance of a person's earlobes can potentially provide clues about their risk of heart disease. There is some evidence to suggest that changes in the way a person's ears look could be an indicator of their risk for a heart attack. This phenomenon is known as Frank's sign or diagonal earlobe crease. This crease is named after the doctor who first noticed it as a potential indicator of heart disease in the 1970s. The changes in the earlobe may be indicative of an increased risk of heart attack. This is because the earlobe is supplied with blood by the same arteries that supply blood to the heart. When there is a blockage in the arteries that supply blood to the heart, it can also affect blood flow to the earlobe, causing changes in the tissue there. According to research, this crease, which runs diagonally from the ear canal to the lower edge of the earlobe, can be seen in up to 80% of people who have had a heart attack. The link between the earlobe crease and heart disease is not entirely clear, but some experts believe that it could be related to the loss of elasticity in blood vessels, which is also a risk factor for heart disease. One more study published in the American Journal of Cardiology found that people with creases in their earlobes were more likely to have heart disease than those without creases. The study's authors theorized that the creases could be a sign of decreased blood flow to the earlobe and a marker of atherosclerosis, or hardening and narrowing of the arteries. By examining a patient's earlobes, doctors may be able to detect early signs of blood vessel damage and take proactive steps to prevent further damage and reduce the risk of heart disease. However, it is important to note that the presence of earlobe creases alone is not a reliable predictor of heart attack risk. Other factors, such as age, family history, smoking, high blood pressure, and high cholesterol levels, also play important roles in determining a person's risk of heart disease. If you are concerned about your risk of heart disease, it is important to talk to your healthcare provider, who can assess your overall risk and recommend appropriate screening and preventive measures.